Can taking a simple and inexpensive over-the-counter supplement that's commonly given for joint health reduce your risk of death from a heart attack? Well, there was a doctor that published that in 1973 after doing some studies in the 1950s, and he was roundly ignored because we were right in the throes of Ansel Keys and the cholesterol hypothesis for development of heart disease. So this guy got ignored, basically. He didn't do huge studies, but he had some kind of amazing results. And then nothing was done along those lines until a very large study that was published in 2021 that was done in Spain. And I bet you've never heard of it. Hardly anybody else has heard of it. And when I looked at the people that had read it and looked at it and shared it, I found 8. The study was done by researchers in the Department of Cardiology, the Department of Rheumatology, and Clinical Pharmacology at a university, several universities in Madrid, Spain, and then published in, July of 2021. So let's look back at the first guy that published in the Journal of Angiology in 1973. So here's the study from Lester Morrison, Coronary Heart Disease Reduction of Death Rates by Chondroitin Sulfate is the supplement we're talking about, in the Journal of Angiology, Volume 24, Issue 5. And here's the link if you want to look it up. Dr. Morrison spent 50 years looking for ways to reduce arteriosclerosis. He was the director of research at Loma Linda University Institute for Arteriosclerosis Research, and started talking about and looking at first choline and then lecithin and then chondroitin sulfate for reducing coronary heart disease, coronary artery disease, and reduction in heart attack. Heart attack had killed both of his parents, so he had a vested interest personally for figuring that out. And he wrote about it in 1982 after he'd been soundly ignored for so many years, stating that most of his time had been devoted to studying ways of reducing heart attacks and cardiovascular death, still the #1 killer of people worldwide. He provided compelling evidence in the 1960s that natural molecules, specifically chondroitin sulfate, could reverse arteriosclerotic fat plaque and prevent heart disease 20 years before a statin ever made it to market. Comes now a group in Madrid, Spain, that looked at 3.7 million patients between 2002 and 2015, aged 40 to 99 years, and they published their findings in 2021. Here's their study, Risk of Acute Myocardial Infarction Among New Users of Chondroitin Sulfate. And here's the link if you want to look that one up. The other supplement they looked at was glucosamine sulfate. And in Europe, both of those are by prescription. In the United States, both of those are over the counter and sometimes sold in a combination. In Spain, they are prescribed either glucosamine or chondroitin sulfate, so they were able to look at a pretty well-controlled group and compare those two supplements to those not taking either. This research group starts out discussing the fact that osteoarthritis and cardiovascular disease are epidemiologically related from chronic low-grade infection. And straight from their paper, atherosclerosis is a chronic inflammatory disease characterized by activation of the immune system. Glucosamine and chondroitin are different. Glucosamine is an amino sugar, and chondroitin sulfate is a glycosaminoglycan, and is involved with the buildup of the extracellular matrix in connective tissue. Several months ago, I did a video on the glycocalyx, lining the endothelium, the inner surface of arteries, and the damage that occurs from low-grade inflammation, carbohydrates, and sugars. And that glycocalyx, the same thing that makes a fish slippery, is made up of glycosaminoglycans, which is what chondroitin sulfate is. So what did they find? I'm going to read you their exact conclusions from their discussion. In this large population-based case-controlled study carried out in Spain, primary cohort of 3,764,470 patients, from which more than 23,000 incident acute myocardial infarction cases emerged, we obtained the following main findings. 1. Current use of chondroitin sulfate is associated with a reduced risk of AMI, heart attack, by 40%, suggesting a substantial cardioprotective effect. Number 2, such effect is observed in both men and women, irrespective of age, and in both short-term and long-term users. Number 3, likewise, it is observed in subjects with intermediate and high cardiovascular disease risk, but not in patients at low risk. And number 4, it is observed in patients who are non-users of non-steroidal anti-inflammatory drugs, but also in those that also are using non-steroidal anti-inflammatories. And number 5, current use of glucosamine does not increase or decrease the risk of acute myocardial infarction. So it's chondroitin. Doesn't seem to make a difference if you are at low risk, and your age is irrelevant. And it works in short-term and long-term. 40% reduction in heart attack rate. And then the most fascinating thing, the media coverage, which would be 0. I'll show you the metrics. So 8 people have published that or tweeted that on X, me being one of them. Citations were 9, media coverage none. Mentioned by 8 X users, citations 9. I'm not telling you to do it. I'm not saying they're right, but the information is out there and hasn't been looked at for over 40 years until this group started looking in Madrid, Spain. Have a great day. I'll talk to you later. See ya. Bye.